Welcome, everyone. We are delighted to have you join us here this evening for our MEDTalk event, Healthy Aging, Some Things You Want to Know, and maybe a few things you don't, we'll see, or Aging Wisely. So we've got two titles presented by Dr. Mariana Dangiolo and the UCF College of Medicine. So my name's Chip Roberts. I am Assistant Vice President for Advancement for the college, and I will be introducing Dr. Dangiolo and then finishing up when we're done. A few housekeeping items. I know this is like the, when you get in the airplane. And okay, here we go. During the presentation, we ask that you please make sure your microphones are muted. If you have a question during the presentation, please feel free to type that question in the chat box that will appear on the bottom of your screen. And we will be sure to go over all questions during the Q&A portion of our program, and Ryan will ably help us with that. And now we're going to get down to some business. So I am delighted to introduce our featured speaker this evening and friend and colleague for at least 10 years, I guess. Dr. Mariana Dangiolo is a board-certified family physician with subspecialty certification in geriatric medicine. She's active in the American Academy of Family Physicians, Mayo Clinic Alumni Association, American Geriatrics Society, Physicians for a National Health Plan, and the Florida Medical Association. Dr. Dangiolo is board certified as a member at large of the Florida Geriatrics Society. And she has a really long and impressive CV. And if I did it all, we wouldn't have any time to hear her talk. So the college, we welcomed Dr. Dangiolo in June of 2010. I can't believe it's been that long. In her role as Associate Professor of Family Medicine, she serves as the Director for Geriatrics and Palliative Medicine and is an active educator for the Practice of Medicine modules of the college. She is a two-time recipient of the Richard Tucker Cooperative Gerontology Research Award and is the only board-certified geriatrician at UCF Health. And before I say please welcome her, I have to also say that her patients and everyone who meets her absolutely love her. She is terrific. So please do welcome Dr. Dangiolo.
Thank you so much for a beautiful introduction. I'm honored to be here today, and I hope you will find my presentation interesting and useful. Thank you for joining us today. I'm very, very happy to be here. So I'm going to present a little bit about aging, some facts and helpful tips related to aging well. So we know that there is approximately 900 million people who are 60 years old and older, and the population is increasing. So given this amazing number of seniors, one of the most important things for me as a geriatrician and in general in healthcare is to try to achieve successful aging, which means to be active, be independent, be able to enjoy life. That although successful aging might mean many things for many of you, many different things, but being active, being independent, being healthy. So lots of people, famous and not so, have reflected on the meaning of aging. In the scientific world, aging can be defined as the decline and deterioration of functional properties at the cellular, tissue, and organ levels. As we age, we lose our homeostasis and the capacity to adapt to stress. We become vulnerable to disease and eventually to death. So when we look at the molecular aging map, it's a pretty complex process, which we don't understand as a whole too much, but we do know certain things. At present, one of the accepted theories is related to oxidative stress. So in the process of metabolism, reactive oxygen species, including superoxide anions, nitric oxide, hydrogen peroxide, can be produced inside the cells. When these reactive oxygen species accumulate and they exceed the antioxidant capacity of the cell, it leads to the destruction of the cell. So these toxins can cause inflammation, cancer, and eventually aging. Another theory is also the telomeres, the telomeres are nucleoprotein structures located at the end of the DNA, and they control the cell division and maintain the genome integrity. So some studies have shown that decreases in telomere attrition and telomerase activity are two of the main drivers of aging. So why do we grow old? Ironic and yet ultimately satisfying paradox may be that the only way that we can actually live as long as we do is to, in fact, grow old. But I'm going to say that not every aging aspect of our organism is negative. Cellular senescence, which is the aging of the cells, evolved as a mechanism of tumor suppression. Aging is an antagonistically pleiotropic manifestation of evolutionary pressures to prevent malignant transformation. So cellular senescence is good for the organism. It's all about balance, okay, between good and not so good, which would be the aging or the death of the cell. So moving a little bit, if we look at this slide, we will recognize that during the last at least 20 years, a multitude of anti-aging practices have appeared worldwide, promising to stop or reverse the effects of aging on the human body. Anti-aging is defined as measures taken in order to slow, stop, or even reverse the phenomena related to aging, as well as to increase lifespan. So in 2020, the global anti-aging market was estimated to be worth about $60 billion. So these are the claims. They claim they can reverse the effects of aging, increase energy, enhance virility, enhance the immune system, eliminate your joint pain. And this comic shows the conquistador Ponce de Leon looking for the fountain of youth when he came to America. But guys, no matter what we try, we still cannot stop the aging clock. So here you can see our bodybuilder, Arnold Schwarzenegger, well, former bodybuilder, actor and governor, Schwarzenegger, who, you know, throughout the years, and you can see, unfortunately, that the aging clock ticks and moves forward. So looking, you know, at how the body shrinks as we age, there is a concept that is called sarcopenia. Actually, sarcopenia is age-associated decrease in muscle mass and strength. It decreases our capacity for physical work. And it has to do also with this oxidative stress I described before. One of the important things here is to, you know, that sarcopenia is also related to another entity called frailty. Both are really increasingly prevalent with age. And there is overlap between these two conditions. One of the things these conditions have in common is low grip strength. So the capacity of the strength of the grip, okay, on the hand, slow gait speed, and low muscle mass. So these three measures have been associated with a wide range of aging outcomes. Just to mention one, we need a gait of 0.8 meters per second for an independent community ambulation, so to walk around the streets. So gait speed is the single strongest predictor of future disability and death. So when people come to my office, I can test all these things with very simple tests, okay? Test grip strength, gait speed, and actually I can predict about the risk of an individual patient to have disability, falls, cognitive decline, ending up in the nursing home or dying. So what is the 21st century of this sarcopenia and frailty? As yet, I have to say there's no recommended drug treatment for any of these two entities. But we know that resistance training have been shown to be effective. When we say resistance training, I'm saying pumping iron, okay? That type of work, and it could be done with free weights, could be done with elastic bands, or could be done with the weight machines. And the problem with resistance training is it has been shown to be effective. It can definitely improve some of these, the muscle mass loss and such. But the problem is that a lot of older people are unable or unwilling to exercise at the required intensity that we have to do in order to improve these aspects. Another, there's a lot of research in this area, and I'm just going to mention one more. There is an observational study that initially suggested that angiotensin converting enzyme inhibitors, you are probably all familiar with drugs like lisinopril or enalapril to treat hypertension. They might be of benefit for physical function. And a finding subsequently confirmed in a trial that people who were exposed to one of these drugs improve their speed walk. More trials are ongoing on this. So as I said before, risk of injury, I mean, I didn't mention that, but actually people not willing to really do the type of resistance training that you need to do in order to improve your muscle mass. But I would say that at least aim for at least what the guidelines say about exercising in older adults, at least 150 minutes of moderate intensity aerobic activity, and at least 2 times a week, some resistance training, okay? As I said before, some free weight or elastic bands or some machines. This is a trial where they reflects the importance of walking. 16,000 women around 72 years of age went through this study, and they average, the women who average 4,400 steps a day had lower mortality rate following a follow-up of around 4.3 years versus the least active women who average 2,700 steps. So we need to walk. Let's look at vitamin D and the impact on falls and gait. So we know falls are a major risk factor for hospitalization, are the leading cause of injury and death in adults age 65 and older in the United States. Each year, an estimated 25% of adults will have at least one fall, and more than 3 million people are treated in emergency departments for injuries related to falls. Now, recurrent fallers, so someone who has fallen more than once, had twice the rate of being admitted into a nursing home. It seems that, well, observational studies suggest that there is an inverse relationship between vitamin D levels in the blood and falls. What we do know is that vitamin D improves balance. But apparently, most studies have shown that it's not really helping in terms of muscle strength. Well, switching a little bit, what about growth hormone deficiency? So growth hormone. There has been a lot of interest in, again, investigating and doing trials on growth hormone related, to aging, sarcopenia, and frailty, as I've said before. What we know, I mean, as we age, there is a decrease of concentration of growth hormone in our body, and also of other important hormones like insulin, like growth factors. They're all related to aging. So growth hormone maintains bone density, muscle mass, so really has an important action in the musculoskeletal system. So initial studies show that the growth hormone increases muscle mass and decreases body fat in healthy age men and women. Now, when we look at, can we extend life? Can we live longer if we get synthetic growth hormone as we age? Well, so far, no functional benefits on life extension. There is also a lot of controversies among different studies. It seems that too high or too low levels of growth hormone, the other one is insulin growth factor, they seem to be associated with reduced longevity. We really don't know if people who have been receiving synthetic growth hormone as they age, they look better, more lean, muscle, less fat, but because also they are doing physical activity. We do know that physical exercise is a very important regulator of these two hormones, of the growth hormone and the insulin growth factor. And so we do know that physical exercise probably is key here to try to preserve some of this hormone in our body. What about testosterone? I would say to start with, low testosterone is defined as less than 350 nanograms per deciliter in blood, or less than 50 picograms per milliliters of free testosterone. We do know that on people who were frail and deficient of testosterone as they age and participated in studies with testosterone replacement, there was an improvement in a lot of aspects of the metabolism, especially the glucose metabolism, improving insulin resistance, improving, similar to the growth hormone, stimulating lean body mass, so muscle, and reducing the body fat, also improving significantly bone density, reducing risk of falls and hip fracture. Now, the effect on memory and strength is controversial. Now, let's look at risk of this hormone replacement. Growth hormone and testosterone, they both have a lot of risk factors, if, of risk and adverse effects if they are used. They can cause cancer. There's also increased mortality. There is enlarged prostate for the testosterone, can enlarge breast, and actually, for example, testosterone can increase cardiovascular risk. So they need to be used with caution. Moving a little bit to therapy for women, hormonal therapy, hormone replacement in menopause. One of the biggest studies has been a Women's Health Initiative study, which looked at women aged 50 to 79-year-old. This study assessed the long-term effects of hormone therapy in postmenopausal women. So the study, unfortunately, was ended early due to findings of increased risk of coronary heart disease, breast cancer, stroke, and also clots complication in women receiving particularly the combination of estrogen and progesterone compared to the women who were receiving placebo. What we know that women who were treated just with estrogen because they did not have uterus, so they didn't need the counterpart of the progesterone, those women had less adverse events than the group that was receiving the two hormones, estrogen and progesterone. Well, later we have also learned something that I put in red there, that actually starting hormone replacement in younger women who are menopausal but have been less than 10 years from the last menstrual period is actually safe and effective. It will improve menopausal symptoms, hot flashes, dryness, etc., and improve bones. So can actually improve and actually prevent osteoporosis and actually improve the lipids, the cholesterol. Moving a little bit to Alzheimer's. What is taking so long to really find something for the cure? And one of the main things is the unclear pathophysiology and actually the multiple factors that are involved in Alzheimer. So we also know that there's a large loss of brain, of neurons, before we have clinical symptoms. So by the time we have, it's kind of late. The other thing is we don't have established biomarkers to do a preclinical detection yet or to monitor treatment. But I want to say a word of the brand new drug, Aduhelm, which is aducanumab, and is a monoclonal antibody recently approved by the FDA under an accelerated pathway that has been criticized all over the media and by also the scientific community. Aduhelm is a drug developed by Biogen and Essay and targets amyloid beta. And actually, so it was accelerated the approval based on the biomarker that it targets, which is what is targeting is that amyloid, that bad protein that deposits in the brain in people with Alzheimer. But the main thing I have to say about it is that there is a strong concern about the side effects. Particularly the side effects I call area, they are edema and hemorrhages in the brain. The drug is going to come in the market soon, will require an MRI, baseline MRI, and then MRI at week 7 and at week 12. So the person will have to have, the patient will have to have either mild cognitive impairment or a very mild Alzheimer with a mini mental status exam of not more than not less, than 26/30. So will be used if we use it, if we prescribe it in the beginning of Alzheimer, with a lot of caution, monitoring the brain with ongoing magnetic resonance imaging. It is an IV drug and it will require a once-a-month infusion. So moving to vitamins, the guidelines say that vitamins and mineral supplements do not prevent cancer or heart disease. Now there's a Cochrane review that says that actually mortality can be increased with certain supplements or vitamins like beta carotenes, possibly vitamin E and vitamin A. So we have to be cautious when we consume vitamins. For vitamin D deficiency, that's another area, You know, vitamin D deficiency is a level of less than 20 nanograms per ml. Actually, a lot of people in the community really take the 30 nanogram as a cutoff, but anything between 20 and 30. We need a maintenance to maintain a good level of vitamin D in our body. We need to consume between 600 and 800 a day. But sometimes maintaining more than 30 nanograms, we might require at least 1,500 units a day. Okay, people with malabsorption syndromes and take medications which can affect vitamin D metabolism, those people should be at higher doses. This slide also is looking at for asymptomatic adults. And I want to say that overall, just routine vitamin D screening cannot be advised. But for my patients who come and have fallen, I already assume they are vitamin D deficient and I start treating them. I don't really need to look too much at the vitamin D levels. But another thing we need there are studies that have shown that vitamin D is associated with a reduction in falls, but not in fractures. So there is a lot of contradictions, okay? So it's not perfect. We do know that improved balance as a take-home thing, and so it's worth to try. If you are deficient, yes, I would say take a supplement of vitamin D. In terms of calcium, how much calcium we need, yes, there's a strong recommendation of the guidelines to take at least 1,200 milligrams a day. What about fish oil? Several epidemiological studies suggested a reduced risk of cardiovascular disease associated with fish oil consumption, and also, well, omega-3 have strong anti-inflammatory properties. Omega-3 are inside of fish oil, are part of fish oil, and they have also anti-inflammatory properties, and they're very beneficial for conditions that have to do with inflammation, including cardiovascular disease. They can actually improve, it can actually improve blood pressure and improve cholesterol. Moving a little bit to some people who have lived really long, I believe this is the woman who holds the record of the person who has lived the longest, the French lady in the Alps, Jean-Louis Calment. She lived until the age 122. She quit smoking at age 117. In addition to wine and chocolate, she ate food with lots of olive oil, which she also used on her skin. Spirituality. There is a lot of data on spirituality and positive aging. People who are religious or, have some spiritual life have improving functioning, improving cognition, better coping skills for stress, less depression, and less suicide. Okay, guys, let's look at the real Hollywood aging secrets. And let's see what Cindy Crawford says. So I'm not going to lie to myself. Past a certain age, creams work on the texture of your skin, but in order to restore elasticity, all I can really count on is vitamin injections, Botox, and collagen. So what works? Regular, Yates has done, is part of, has done a big study and actually described that regular exercise, smoking abstinence, weight management, and blood pressure control increases longevity and improves functional status among older men. Well, that was his study. He was looking at older men. Let's look at diet alcohol. This is another big study done in Europe, the HALE study, and look at Mediterranean diet, moderate alcohol use, physical activity, and non-smoking were associated with more than 50% decrease in the rate of mortality in healthy 70 to 90-year-old people. Also, Mediterranean diets, we know that they lower the risk of diabetes and lower cholesterol levels. And some words on plant-based diets, you know, for those that likes them and they're vegan diets, there is benefit on, they have really demonstrated benefit on weight, absolutely. Yeah. Obesity, diabetes type 2, systemic inflammation, and they can also improve cholesterol. What is unclear is how plant-based diets can actually have a positive effect on memory or brain health overall. And also mortality rates is a little bit controversial. I guess we need more studies on the plant-based diets. It's kind of a new thing. This is another study was done. It was a 35-year study on 2,200 men. They have to follow at least 4 of these 5 rules: regular exercise, sensible eating, maintaining weight, minimal alcohol, and no smoking. And after the 35 years, there was half rate for diabetes and vascular disease incidence in those people who follow those rules, with lower mortality rate. Increasing your odds, go to your doctor, get your annual exam, make sure that you treat if there is hypertension, high cholesterol, check for your bones, get your immunizations for sure. And well, this is my opinion. Dance is beautiful. You can dance or you can do any other exercise you like, but particularly dance improves balance and gait, improves mental health, social, it's super fun. So I don't think I might be able to turn on this video. This is a beautiful video that I had, but I don't think I can start it. Let me see. Well, I can't, but I wanted to show you this gentleman that actually, I believe he's still dancing in the streets of Buenos Aires in front of a very famous galleria. This is a peatonal street. It's called Calle Florida. For those who have been in Buenos Aires, I'm Argentinian. And when I took that photo, it was about 3 years ago. It's a beauty. You can see, I mean, I wanted you to enjoy his beautiful dance. Amazing that someone can dance like that at that age. Okay, so don't forget to drink water. And these are the conclusions. Anti-aging is not the same as healthy aging. Media purported intervention have not been proven to be effective. There's no biological interventions that significant impact longevity and frailty. And at the end of the day, what we know is that moderate lifestyle is the most important intervention. And of course, if we're going to live long, we need to look at our finances, right? So careful financial planning to have a beautiful, long and happy living. So this is what Bob Hope thinks. I'll tell you how to stay young, hang around with older people. Well, that's what I do as a geriatrician, and I think it's fun. I want to acknowledge Dr. Adal Golden for contributing to this talk. And this is my family, my 5-year-old twins, John and Marie, my husband, Matthew. And I wish you guys a long and happy life with many more healthy birthdays to come. Thank you.
Thank you, Dr. Dangiolo. Can you hear me?
Yes.
Yes, okay. Let's have a round of applause for Dr. Dangiolo, that wonderful presentation. Thank you so much. Thank you for sharing those insights with us tonight. And I want to thank all of our friends and guests for joining us. And we will go into the Q&A here in just a moment. But I wanted to see if acknowledge Dr. German, I believe, has joined us. Is Dr. German?
Yes. Hi, everyone. I came a little late. I had another engagement, but I'm so happy, Mariana, Dr. Dangiolo, to hear your presentation. It's wonderful to know what helps and what doesn't for keeping us all young. And I have to say, the photograph of the woman with the cigarette and the 100th birthday. So let me tell you what I thought when I saw that. I thought that she might have been a smoker and she quit. And she told herself that if she made it to 100, she would have one last cigarette. And I'm hoping that's what that was all about, because if she's been smoking her whole life, I think we send a mixed message there. What do you think?
Well, the image is the woman who has lived 122 years, Jean-Marie Calment, the French lady, who actually quit smoking at age 117. So that kind of brings another point, that we're not stimulating people to start smoking or continue smoking. Actually, when we show the 5 points of, lifestyle modifications, and those people who really live longer and follow those 5 behaviors, that's the real thing to do. But we're talking about privileged organisms, privileged bodies, and I haven't really mentioned genes here, but it's not only what we do with our bodies, it's also what we bring inside. I truly believe that, I don't know if it's 50% genetic, but definitely we choose our lifestyle, we follow behaviors, lifestyle behaviors, but also you have to have good genes to actually accompany your choices.
Well, thank you.
Well, and thank you, Dr. Dangiolo. We have reached our Q&A portion, and we want to encourage everyone to join the conversation. And there are 2 ways you can do that. You can either raise your hand by going to the bottom of your Zoom window, clicking on reactions, and then clicking raise hand. Or you can submit questions directly to the moderator using the chat window. So I know we have a couple of questions that have already been sent. First one here. If you have a balanced diet and live a life with lots of outside activities, why do you need vitamins, including vitamin D?
Great question. I would say that if you eat very balanced, and well, of course, you can have your days where you enjoy your ice cream or your preferred cake or your spaghetti. I'm Italian. I love, to eat spaghetti and stuff like that, but pizza. But what I mean is, I think if you have a balanced diet, you do not need to add vitamins. I support using vitamins, including vitamin D, when there is a deficiency. Okay, so ask your doctor if you, or for example, there is a suspicious of, a doctor thinks that you might be deficient in vitamin D because you've been falling or because you had a fracture. Then yes, let's look into that and replace what is not there or whatever is deficient. But if you have a balanced diet, my message is you don't need multivitamins.
Thank you. And it looks like, Gary, you've got your hand up if you want to go ahead and unmute your microphone. Let's see. Can't hear you quite yet, Gary. There you go. Oh, you remuted again.
Uh-oh, can you hear me?
There you go. Now we got you. Go ahead.
Well, I was wondering, there are people in Italy that are long-lived, and I was thinking there might be some genetic studies that would show certain factors that in their genes that led to their long livelihood.
Well, I'm not, that I mentioned before, I truly believe that it's not just what we do with our life or what the choices that we pick, but also the genes that you bring. Now, yes, there's genetic studies and there are lots of them. For example, we do know that definitely the telomeres have an important aspect in aging, right? So the shortening of the telomeres, which are the nucleoproteins at the end of the DNA, have something to do with aging. So, and there are so many things that influence the genes as well, not just our nutrition and our choices, but definitely, exposure to UV light, radiation, and other things, toxins, chemicals. So, but yes, you have families who you see that they are centenarians, mom, grandmother, great grandmother. So definitely the genetics are there.
Thank you.
Thank you. It looks like we have Hari, you have your hand up, but real quick before I go to you, we have a question about the presentation. Could you please repeat the gait? Is it 3.8 meters per second, Dr. Dangiolo?
0.8 meters per second.
0.8.
Yes, so a little bit less than 1, right? 0.8 meters per second is the type of gait. So I'm going to tell you, for example, what we do in the clinic, we test something so easy. It's a validated test, it's a standard test, it's simple, and it's called the Get Up and Go test. So the patient is sitting on the chair and we ask the patient to stand up, walk about 3 meters, and turn around and sit back. So and we tell them to do it at their best pace, right? So not running, but good pace. And so we time it, and if the time to do the test is more than 13 seconds, we know that that person is at risk of future disability, falls, and more. So it's very important that if you notice that you're having balance issues, or that you have a slow walk, pace walk, or or you have already fallen, please go to your primary care physician, better a geriatrician, to address the causes or possible causes of your falls, which are multiple, from hearing, sight, musculoskeletal, medications. So one of the things I do as a geriatrician is spend a long time looking at people's medications and how they can influence gait, among other things.
Thank you. Okay, it looks like Hari, you've got your hand up. You want to unmute?
I enjoyed your presentation, Mariana, very much.
Hi.
I work on the other spectrum of patients, being a pediatric surgeon, working with kids. We never worried about aging. You mentioned all the aspects, almost quite a bit. You didn't mention the role of genes and the role of having a nice, well-understanding, loving family, and sex relations do play, don't they?
Absolutely. Well, we have some time for the presentation. You told me 30 minutes, so I picked up some aspects, There's so much more to talk about aging. I did mention spirituality, but definitely, as I show in my photo at the end, family, right? So love, family, absolutely. Yes, probably the way we age, it all starts in the beginnings, right? In the center of our family where we grow up. And it depends so much on the food we receive, the love we received, the activities we did, the experiences we lived when we were children.
Thank you.
Sex, of course, yes, yes. So we could talk, I mean, this should be probably a complete different presentation for next time.
Thank you. So what are your thoughts on coconut oil due to its medium chain TGA on Alzheimer's and Parkinson's?
There is no data on coconut oil and Alzheimer and Parkinson. I mean, valid data as far as I know.
Okay. The exact question was, there are some reports on the effects of coconut oil due to its medium chain TG on Alzheimer's and Parkinson's DXS. Any thoughts?
Well, coconut oil has one of the healthy, oils, that we need to be consuming, as for example, I mentioned olive oil as well. So the thin oils are the ones we want to consume, and they are the polyunsaturated oils are very, in general, healthy, and they have antioxidant properties. So probably that's a little bit maybe where the question goes, that I do believe that we have to consume good oils, the oils that have antioxidant properties, and not the saturated oils. And actually, yes, the brain is mainly fat. So definitely, antioxidants in general promote healthy aging.
All right, thank you. Calcium. Always thought it was needed for bone strength, particularly as you age, but recently heard something about calcium buildup in arteries. Can there be too much? Often intertwined with vitamin D. I do take a multivitamin, has enough of RDA for D, but not for calcium.
So yes, so as I said before, there is a strong recommendation about consuming a diet with at least 1,200 milligrams of calcium a day. If that's the question, I mean, you don't need to add extra calcium unless you have a calcium deficiency. But typically, our regular diet have about 500, 600 milligrams of calcium in a diet. So I wouldn't say that people consume completely through the diet the 1,200 milligrams that are required. So in general, if you know that you don't like too much cheese, or you don't take, you don't eat any food rich in calcium, you should add a little bit to complete and get to the target of 1,200 milligrams. And yes, it's important if you're taking vitamin D because you are deficient in vitamin D, to make sure that also calcium is accompanying and you're getting a good balanced level of calcium as well.
Thank you. What are your thoughts on telomere testing?
Well, it's still, under investigation. I mean, it's not something that is at this point, an ordinary test to order. It's more at the level of scientific trials. But soon, as many things in medicine will become something more more available for regular public, we'll see what happens.
So if any of our guests here on the call this evening want to become your patient, how do they do that?
They need to call our clinic. I'm at UCF Health, You know, unfortunately, recently, my panel of patients have been closed, but I've been taken by, you know, request specific cases. So I will be happy to look at. I mean, I'm currently, you know, I've been in the clinic for over 10 years, so I have a very big panel of patients. But I will be happy to take the patient or look at least at the case and see if you know, I can take as a patient. But it's true that if you call the clinic, they're going to tell you that I'm not taking new patients, but please communicate with me directly, and I can look at that. That's how I'm doing it now. I'm going case by case and taking the patients that need to see me.
Thank you. What are your thoughts on Fosamax?
Alendronate, yes, it's a biphosphonate and it's a medication used for osteoporosis. So yes, it's, at this point, it's kind of the gold standard. It's the first medication we look at using when someone has osteoporosis, or or some levels of osteopenia that also might require it. But it's a good drug. It does cause some gastric, it could cause some gastric irritation and esophageal, some gastritis or esophagitis or reflux of acid. So consult with your doctor if you are a good candidate for a drug like that. But overall, it's safe and it works.
Do you ever allow students to come and shadow you at the facility?
I do. We have several programs at the College of Medicine where our students are shadowing us. So that's part of our College of Medicine training. Students from every year, each of the 4 years, as part of the practice of medicine. We have clerkship students in the 3rd year, and we have also 4th year medical electives. We are not taking at this point students that are not to shadow us, students that are not part of our College of Medicine due to many things, space and stuff, and the coronavirus and many things. But yes, our students at the College of Medicine have a very active participation in our clinics.
And I think this will be our last question here. Tell us, are there other geriatrians in the Orlando area?
There are other geriatricians in the Orlando area, board certified geriatricians, and I would be happy. There's some at Advent Health, and there's some very good ones at Orlando Health. Orlando Health in particular has a center for aging, but also Advent Health has another one too. So, you know, you can look up on internet and put geriatric medicine in those 2 centers as well. If you guys have any questions, I would be happy to share my email, and you can contact me with any further questions or concerns. Please feel free to call me or to send me a message.
Well, thank you, Dr. Dangiolo, and thank you to everyone for your wonderful questions and engagement. And with that, I'd like to hand it back over to Chip Roberts.
Thank you, Ryan. Thank you, Dr. Dangiolo. That was fantastic.
You're welcome.
Just to make it a little easier, if you want, because I know we have everyone's contact information for this, and we set this up, you know, when you replied, we can connect you with Dr. Dangiolo. So I think Aaron Turner can assist with that. If you're interested, just let us know and we'll make that connection and we'll make it a little easier for you. So that being said, thank you to our friends, our guests. We look forward to doing events like this in the future. Of course, in education, research, patient care, we try to cover all those areas in our medical school and our academic health science center. Sort of not so behind the scenes, but working both behind and in front of the scenes. Thanking Ryan Rutherford for your terrific moderating of our Q&A as always in tonight's event. Thank you to Aaron, who really spearheads this and does the lion's share of the work to make these possible. And I know Rachel Backus, Aaron Turner and Rachel Backus, who helped her. So just a couple things quick. Following the event, you're going to receive an email with information about the college and ways that you can become more involved. And that could be in a lot of different ways and areas. And I just, would encourage you to think about the areas that are of interest and passion to you, because it's amazing how much of a difference, it can be made by one person and by every person who helps. We've seen that time and time again in the history of our college. And you will receive a link to a survey so you can provide feedback for future events. So we want to know what you think, what works, what might not work as well, the topics that are of great interest to you. And I see the email came up there. And so we can provide additional great programming such as we've had tonight. I think, is there anything that I have missed? I hope, Aaron, if I have missed something, just come on and tell me. If not, it's been a wonderful time together. I know I've learned a lot. And we look forward to the next one. Please do provide that feedback. Dr. German, is there anything you would like to say in closing?
I would just like to thank everybody for being here. And I notice we have such a mixed group of people. We have individuals from that serve on boards. We have some of our donors. We have some of our staff and community members. And there's nothing more pleasurable for me than to see the full breadth of people who support our College of Medicine all together on the screen, learning from the very charismatic and lovely Dr. Dangiolo. So, and thank you, Dr. Dangiolo. It's always delightful to hear you teach all of us and our students. I really appreciate it. Thank you.
Thank you. Thanks again. I'm going to go and lift some iron and cut my dinner in half and do all the things you recommended. I think they're good, strong advice. So we're going to go follow them. Thank you, everyone. So nice to have you joining us. Great evening.
Bye.
Good night.